Hello, everybody. Thank you for tuning in. Today, we're doing an educational presentation for the Stockton community on COVID-19. My name is Ramon James.
And I'm Chuck Lee.
And I'm Samantha Chung.
And I'm Albert Dickerson.
All right. So, coronavirus disease is also known as COVID-19. It's an infectious disease caused by the SARS-CoV-2 virus. The virus is spread through the air when people breathe out. That means COVID-19 is an airborne disease. When someone with the virus coughs or sneezes, it produces particles called droplets that can remain on surfaces. The droplets can also be spread by a cough or a sneeze when near someone infected with COVID-19. The virus is usually spread by close contact with someone infected with the virus or contact with the surface exposed to the virus. Most people infected with COVID-19 will have mild to moderate respiratory symptoms and will recover with no special care. Some people, such as babies under 6 months old, adults over 60, and the immunocompromised are at risk for serious illness requiring hospitalization or death. Some people report having symptoms that continue for months. This is known as long haul COVID. So there are two types of tests for COVID-19 to diagnose it. The first one is molecular tests. These are highly accurate tests done by medical professionals. The test looks for genetic material from COVID. These tests are called polymerase chain reaction test, which is what PCR stands for. Antigen test, these are the second type. These tests look for viral proteins called antigens. These tests are called rapid tests. They are less accurate than molecular tests, but are used for quick results. These can be bought at the store and done at home.
Signs and symptoms of COVID-19. Headache, cough, shortness of breath, difficulty breathing, muscle pain or body aches, fever, diarrhea, nausea or vomiting, congestion or runny nose. These signs and symptoms are very similar to the flu. So here are some distinct symptoms of COVID-19. New loss of taste or smell, constant smell of metal or unusual smell, feeling very fatigued. Seek emergency medical attention if extreme trouble breathing happens, chest pain, new confusion, inability to stay awake, pale, gray, or blue colored skin, lips, or nail bed. COVID-19 exacerbations are defined as worsening symptoms or post-infection effects. The severity of these exacerbations varies greatly, and they can impact several organ systems, resulting in illness such as multi-organ failure, myocarditis, acute respiratory distress syndrome, and pneumonia. The most common causes of exacerbations include underlying medical conditions such as diabetes, hypertension, obesity, older age. More severe symptoms and problems can also result from co-infections with other diseases or other variations of the virus.
When speaking of treatments, most people experience mild symptoms. With these symptoms, people can recover from home. When given the opportunity to take over-the-counter medications, they can take acetaminophen or ibuprofen. But there are those who are immunocompromised. And for these patients, they are the 65 and older, unvaccinated, and people with certain medical conditions. And for these people, antivirals will reduce chances of hospitalizations or death. There are three different methods of taking these antivirals, and these are the ones that are listed below. Different routes and different times to take it, and also different ages. Depending on how sick an individual is, a healthcare provider may choose to add other medication that respond to the virus, treat infection, and reduce an overactive immune response. For prevention, the most common and most important one is hand hygiene. The next one after this is masking and social distancing. But there are vaccines that were not available at the start of COVID-19. Vaccines protect people from getting seriously ill, being hospitalized, or death. So you're best protected when you're up to date. For people that are older than 65, people should receive one additional dose of an updated COVID-19 vaccine. Pre-exposure prophylaxis medication is also available. There's an FDA-approved preventative mononuclear antibody for people who are immunocompromised, 12 years and older, and weigh at least 88 pounds. There's also an investigational medicine, which is medicine being studied. And one of these medicines is called Permgarda. It may be given 2 weeks after the vaccine. The first dose is single IV infusion over 60 minutes, and subsequent doses can be given 3 months following.
For nursing management for COVID-19, it involves a comprehensive approach to caring for patients affected by the virus while ensuring the safety of healthcare workers and preventing further transmission. Here's an overview. It includes assessments, including respiratory status, vital signs, and oxygen saturation levels, infection prevention control, including proper hand hygiene, PPE, and implementing isolation precautions. Respiratory support, the nurses monitor respiratory status closely and administer oxygen as needed. Symptom management, nurses provide symptomatic relief for COVID-19 patients, addressing fever, cough, and other symptoms as needed. Fluid and nutrition management, psychosocial support, since COVID can be isolating and emotionally challenging for patients. Education and counseling. Nurses play a key role in educating patients and families about COVID-19, including transmission prevention. Collaboration and communication. Effective communication and collaboration with other healthcare workers are essential, and continuous monitoring and evaluation. For resources, when you Google search testing locations, the CDC will give you various COVID-19 testing locations, including a link for COVID-19 vaccines near you. Additionally, there are at-home testing kits available. You can find these at your local drugstore, such as Walgreens and CVS.
All right, quiz time. So now we're gonna quiz you guys' knowledge on the information that we just presented. Let's start off with question 1. Question 1, how is COVID-19 diagnosed? Is it A, urine test, B, antigen test, C, your mom telling you, or D, MRI? Put your answer down in the comment section below. All right, let's see what the answer is. We got B, antigen test. You flipped that one? Good job. All right, on to the next question. Question number 2, which one of these signs and symptoms are of COVID-19? Select all that apply. Is it A, cough, B, hair loss, C, new loss of taste and smell, D, blindness, or E, fever? So click all the ones that you think are correct and put it down in the comment section. Give you guys a little bit of time. All right, let's see what the right answer is. Correct. If you said cough, new loss of taste and smell, and fever, you're on a roll. Move on to the last question. Question 3, which of these is the best way to prevent COVID-19? A, drink a lot of orange juice. B, never go outside. C, hand hygiene. Or D, eat veggies. Everybody should get this one right. Put your answer down in the comment section. Give you a little bit of time. All right, and if you chose hand hygiene, you are on a roll. Hand hygiene, very important. Let us know how you did down in the comment section below. Did you get all the questions right? We thank you guys for watching. We hope you guys learned something new, and keep practicing aseptic technique out there and stay safe. If you have any questions, put it down below in the comment section. Like, comment, and subscribe. We thank you guys for watching.